Hi, my name is Audrey Wynn, and I will be your nurse practitioner taking care of you today. So I heard you came in because you've been having some frequent headaches over the last couple years and you are looking for some pain relief. I first wanted to rule out secondary headaches, which are caused by another medical condition in the body. We did some blood work, a physical examination, vital signs, and all of those were normal. You haven't had any associated symptoms like weight loss or motor difficulties. You don't take NSAIDs or Tylenol more than 3 days a week, which could cause rebound headaches, and you're not withdrawing from any medications. You have migraine headaches, and the cause of these is not super well known. We know that it is caused by some neuron dysfunctions in the brain with electrical activity. It's thought that serotonin, an increase of this in the body, can cause vasoconstriction, and then a decrease can cause vasodilation, which can trigger pain receptors in the brain. And this can also cause your body to have some sensitivity to light and sounds and vision. There is a criteria to being diagnosed to these. You need to have at least 5 attacks, which you have had, and the pain has to last anywhere from 4 to 72 hours. Sounds like yours have been lasting for over 24 hours, and they need to meet 2 of the 4 pain criteria, which is unilateral, throbbing, or pulsatile pain. The pain has to be moderate to severe, and it has to aggravate or prevent you from doing any physical activities. And it sounds like you've been having that right-sided head pain that is pulsatile, and that it prevents you from working sometimes. You call in for your shifts, and that it has been moderate to severe. It also needs to have either nausea and vomiting or photophobia and phonophobia. You have had nausea and vomiting, and you said that sometimes you have that sensitivity to light and smells. These can typically happen with auras, which are reversible visual, verbal, sensory things that happen right before the migraine, but they are reversible and go away after the migraine begins. So those can sometimes happen. I heard that you have been using Tylenol and ibuprofen, and that sometimes it works for these migraine attacks, but a lot of times the pain is too moderate or severe. So I want to prescribe you a new medication, which is in the triptan class. It's called rizatriptan, and these medications are agonists of the HT1D serotonin receptors, and this prevents that vasoactive peptide from being released, and they also cause vasoconstriction, which will prevent those pain receptors from being triggered when you have a migraine attack. These are not preventative, so you will just use them at the very beginning of your migraine symptoms. They work better if they're used at the beginning of the migraine instead of the second day, and they should only be taken 1 to 2 in 24 hours. So if it's not working after the first hour, you can take another one, but if you need to have pain relief after that, we'll have to have you come in and see what other options we can do. If there are 5 failed attempts, we can try another type of triptan. There are a couple other classes, and if that doesn't work, we could resort to a medication called the ergoalkaloids, but those do have a lot of side effects. The only side effects for the triptans is sometimes it can cause some hypertension, some chest pain, and some dizziness, but it sounds like you have some great blood pressure, so that is okay as long as you are able to tolerate those symptoms. If you are interested in any preventative medications, we can do beta blockers, calcium channel blockers, atypical antipsychotics are used, amitriptyline, or there's an anti-seizure med called topiramate that can also help to prevent migraines. The outcome for migraines is good if you can help do some lifestyle changes and with pharmacological interventions. So skipping meals and being dehydrated, those can trigger migraines, so make sure you're just always eating and sleeping and drinking well, because lack of sleep can also trigger migraines. Stress can trigger migraines, so implementing some yoga or meditation can help, as well as not being in any severe weather. So extreme heat and severe cold can trigger episodes, as well as poor air pollution. So I know we live in Utah, but trying to prevent those and using those pharmacological interventions should give you some great pain relief.